Hi, it's Dr. Leslie Hawkins, Canadian board certified OBGYN, and today's topic of interest to share with you is induction of labor. Today we're going to go through everything you need to know, including what is induction, what does it look like, what's the process, what to expect, and the reasons behind it. And this is for my own patients as well as my office partners, Dr. Carly Mayo and Dr. Lynn Sterling. And it can go beyond these patients as well. I will give a little bit of specifics on our own hospital, Humber River Hospital, and it could apply to any patients delivering there and also patients across our city and our country. So there is wide applicability to this one. Keep watching if you want to learn some more about induction of labor. So big question, what is induction really? Sometimes when you're in your first pregnancy, you haven't even heard of this word, and that's okay. Induction of labor means giving medications to make labor happen. So basically starting the labor when the body hasn't started it itself. And the goal at the end of the day for induction of labor is to have a healthy vaginal delivery. And that can be achieved in a lot of different ways. There's all different ways to induce labor, and I'm going to go through some of those next. So induction of labor could be done for many different reasons, and it's important to understand the reason that your provider is recommending induction of labor. Some of the common reasons include being overdue, which is also called post-dates. Usually we intervene with induction of labor around 41 to 41 and 3 weeks of gestation, depending on the provider. Another common reason could be a maternal medical condition like gestational diabetes, where our Canadian guideline recommends we induce labor between 38 and 40 weeks of gestation, for example. And another reason could be a reason that's related to the actual baby. So perhaps there's an issue with baby and there's an indication to induce early or at a certain time. Perhaps a patient has twins and there is a recommendation to induce labor at certain gestational ages depending on the type of twins that you're carrying. So there are so many different reasons, and it's important that you as a patient, of course, understand what the reason is that your doctor is recommending it for and ask questions about that and decide together. Ultimately, a decision around induction of labor is a decision that we make together. This is not a one-way decision. Our job is to counsel you on our recommendations, and ultimately it's your decision as a patient to decide what feels right for you. But those are some of the common reasons why we may recommend induction. Okay, so let's get into the nitty-gritty. What exactly is induction? A lot of people have heard, stories from friends or relatives. They're worried it's going to be painful. They're worried it's going to be long. Both of those things are possible, but I think if you're equipped with the knowledge about what it really means, then it can be really helpful. So the way I think about an induction is it's in two parts, part one and part two. And the medical word for the first part, part one, is cervical ripening. So it's really getting the cervix, which is the opening to the uterus, ready. And the cervix is the opening that dilates up to 10 centimeters in order to allow for birth. And so the cervix is starting at some starting point. And a patient needs part one when their cervix is not quite ready yet for part two. So part one is usually a patient who has a cervix dilation of about 0 to 2 centimeters, and they need either a medical intervention or a mechanical intervention to open the cervix and get it ready or ripe. So in part one, there's a few important points. One is that you could be sent home and come back to the hospital several times. So don't be alarmed if, say, you're receiving a medication and then you go home for some hours and you come back for reassessment. Those reassessments are anywhere from every 2 to 12 hours, depending on what kind of medication or intervention you're receiving. In terms of the options during that time, those options are a decision that's made based on many different things, but usually the obstetrician who's on duty, who's doing your induction, will decide with you what the best fit is for you and your baby at that moment. So it's hard to predict in advance because when you come into triage to get your induction going, we're going to be deciding the intervention that's best for you right in that moment. So all of the different medication options for part one, or cervical ripening, include prostaglandin medications. Prostaglandin is an umbrella term for the hormone that helps to soften and open the cervix, and that comes in 3 different forms: tablets, a tampon insert called Cervidil, and a gel called Prostin. And all of those 3 have different intervals at which we re-examine and reassess you and the baby. And so it depends on what you get in terms of how often you'll be reassessed. In terms of the second option for cervical ripening, or part 1, is a mechanical option called a Foley balloon. So it's a special balloon that we actually used to use only in the bladder to empty the bladder, but now it's used through the vagina and the cervix to help open up the cervix. And so this is a soft rubber catheter that's put in through the vagina and into the cervix with a pelvic exam, sometimes with a digital exam or with a speculum. And the balloon is inflated on the inside part of the cervix so that it produces some pressure against the cervix and helps it to open. And this has no medication in it. So the decision on what to choose, again, is about the obstetrician who's there assessing the situation and deciding with you what the best choice is. And you may end up with a combination of those things. You may need more than one intervention to get through part 1. Once your cervix is ripe and ready, then you move to part 2. And part 2 is two different things. Part 2 includes breaking the water, which we do with a vaginal digital exam. And the second phase of part of that is intravenous, giving you medication through the intravenous called oxytocin. And oxytocin is the contraction medication that mimics the natural hormone that we make during labor. And so that part 2 is done in the hospital, and you stay in the hospital during that part. So whereas during part 1, you go back and forth between home and the hospital, part 2, you stay in the hospital, and you are in a birthing room assigned to your one-on-one nurse, and you receive an intravenous and oxytocin medication, and at some point along the way, the obstetrician on duty will break your water. Occasionally it breaks on its own as well. So in a nutshell, that is induction of labor. And it's important to remember a few really important parts about induction. So the first is that induction can be a really long process. It could take 1 day or 2 days or sometimes 3 days. And that is because we're trying to slowly get the body into labor. So we hope that you don't feel discouraged, even if it's quite a long process. And the second thing about induction of labor to know is that we will request your induction in terms of the process. We'll request it on a certain day, but sometimes the unit is so busy due to other emergencies that we're not able to accommodate on that day. So your induction may have to be pushed by a day or 2 or 3 here or there in either direction, depending on what is going on the labor unit, because it certainly is unpredictable there. The last thing to know is that we're going to help you through the process the whole time, and we're so experienced with induction, as are our amazing nurses. And the people who will be looking after you in the first part of your induction will be in our triage unit, specific to our hospital, and then in part 2 will be in the birthing unit. And our hope is that your induction goes smoothly, and that everything ends up, of course, safely. That's our ultimate goal. During induction, as with any labor, there's a small risk of having a cesarean section for an emergency reason. And so it's also important to know that any of us are at risk for a cesarean section if an emergency happens, and to know that going into your induction of labor. One other important piece of induction of labor is pain management. So during the induction process and the labor process, there are many different pain management options that we offer. And if you're not delivering at our hospital, it's important to ask about what those are. But in our case, we have so many different modalities. So there are some modalities that patients bring in from home, such as a TENS machine. There's one-to-one support during labor, which really helps with pain control and has been studied. That's an evidence-based finding. There are different positioning things like birthing balls, a birthing chair. There's water-based therapies like shower and tub. There are pain medications, either injection medications such as opioids or epidural. And there's also nitrous oxide gas. So we offer so many different things, and they can be used at various times during the induction process. And so we encourage you to voice your concerns about pain and keep that dialogue open with us while you're going through your induction of labor. Well, I hope that helps clarify some of the details on induction of labor. If you're about to go through an induction or you're going through it right now, sending all the good vibes. I hope that it goes really smoothly and really well. We have your back, and we hope that your induction is a smooth process. But don't be discouraged if it is a long one, because that does happen sometimes. And looking forward to seeing you on the other side with your baby in your arms. Subscribe to this channel if you like this content and want some more about antenatal care, OB, OBGYN in general. I'd love to have you. And this is going to be a home base for some resources for our patients as well. Take care.